Welcome to a new episode of Medicine in 3 Minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is diabetic ketoacidosis, DKA. Within this presentation, we will approach successively pathophysiology of ketoacidosis diabetes, symptom, diagnosis, and treatment. We will start by the physiopathology. First detail, hyperglycemia, then ketoacidosis, then ketonuria, then hypokalemia, then osmotic diuresis, symbol of liver, bloodstream, kidney, and lung. Let's start by hyperglycemia. Normally, the body has a mechanism getting glucose inside the cell. This glucose penetration takes place under the effect of insulin. The glucose inside the cell produces ATP, which in turn releases energy. In case of type 1 diabetic mellitus of insulin deficiency, glucose no longer reaches the cell. If glucose does not get into the cell, it builds up in the blood, which is known as hyperglycemia. Normally, glucose gets into the cell under the effect of insulin. Inside, it produces ATP, which releases energy. If for some reason insulin is missing, glucose stays outside of the cell in the bloodstream. If glucose don't get into the cell, there is no longer energy, and the body has a substitute for this energy. Alternative processes to produce energy. The cell uses lipid through fat cells, which they produce free fatty acid, which are dumped in the bloodstream. The cell uses lipid through fat cells, and they produce free fatty acid in the bloodstream. These fatty acid in the bloodstream migrate to the liver to produce ketone. The free fatty acids are converted into ketone in the liver. The accumulation of ketone in the blood is called ketone acidosis or metabolic acidosis. pH under 7.3. I refer you to our video on metabolic acidosis. And bicarbonate goes down. The result of this acidosis is an excess of ketone in the bloodstream. As a consequence, the respiratory rhythm goes up, and the respiratory breath takes a fruity aspect. The consequence of metabolic acidosis is an excess of ketone. The kidney will then eliminate this excess of ketone through urine, which is known as ketonuria. Unfortunately, this elimination of ketone body is accompanied by loss of electrolyte, in particular potassium. This leads to hypokalemia. Osmotic diuresis, We have seen that no penetration of glucose into the cell causes hyperglycemia. Excess glucose is in turn eliminated in the urine. Leakage of glucose in urine is accompanied by leakage of water. This phenomena is known as osmotic diuresis. The water leak is accompanied by a loss of volume or dehydration. Osmotic diuresis is a neurvolemic hyponatremia. He is a body of normal. Is hypervolemic hyponatremia, and he is hypovolemic hyponatremia. Symptom: nausea and vomiting, hypotensive, dehydration, respiratory rate give Kussmaul respiration to eliminate excess of acetone. Kussmaul respiration, inspiration, there is a pause, expiration, and pause. Diagnosis: hyperglycemia, loss of electrolyte, potassium, sodium, chloride. Bicarbonate under 18 is indicator of severity. pH under 7.3, metabolic acidosis. Check for serum ketone level, ketone in the urine, and check for anion gap, sodium minus chlor plus bicarbonate, DKA if anion gap over 12. Treatment: correct the hyperglycemia, intravenous insulin 0.1 unit per kilo per hour, potassium 20 to 30 milliequivalent per liter of intravenous fluid, and intravenous fluid 0.9 saline. In normal body, glucose penetrates into the cell to give ATP, which is a source of energy. This process is under insulin coming from the pancreas. If there is a miss of insulin, glucose builds up in the bloodstream and the cell is missing energy. Fatty acid in the bloodstream build up ketone in the liver. Ketone in the liver is an alternative process to produce energy. The cell uses lipid through fat cell. They produce free fatty acid which are dumped in the bloodstream. Free fatty acid are converted into ketone in the liver. Accumulation of ketone in the bloodstream is called ketone acidosis or metabolic acidosis with a pH under 7.3. The bicarbonate goes down. The result is a respiratory rhythm goes up with breath takes a fluid aspect. The consequence of metabolic acidosis is an excess of ketone, and the kidney will then eliminate this excess of ketone through urine, which is known as ketonuria. Elimination of ketone body is accompanied by loss of electrolyte, in particular potassium, and this leads to hypokalemia. Excess glucose is in turn eliminated in the urine. The leakage of glucose in urine is accompanied by leakage of water. This phenomenon is known as osmotic diuresis. The water leak is accompanied by loss of volume or dehydration. Symptoms include nausea, vomiting, hypotensive, Kussmaul respiration rate, and dehydration. Kussmaul respiration rate, inspiration pause, expiration pause. Diagnosis: hyperglycemia, loss of potassium, sodium, and chloride. Bicarbonate under 18 is indicator of severity. pH under 730.3 is metabolic acidosis. And anion gap DKA is if anion gap over 12. Treatment: correct the hyperglycemia, intravenous insulin 0.1 unit per kilo per hour, potassium 20 to 30 milliequivalent per liter, and for intravenous fluid, and intravenous fluid is 0.9 saline. Thank you for watching this episode of Medicine in 3 Minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.